Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you will have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey veterinary rehabbers, in this episode, Anae joins Megan Doyle from SAAPRA to explore an important question in the management of dogs with intervertebral disc herniation. Together they unpacked the findings from two retrospective research studies that looked at the relationship between the severity of spinal cord compression and the neurological deficits dogs present with before surgery. It's a really great discussion that helps us better understand what we see clinically and what the research tells us about how these cases present. Now, if you like to keep learning, we've just updated the free webinar area with some amazing webinars you can access right now. The small animal one is Talking Tendons, Advances in Management of Tendon Injuries, and that's by Diane Messon. The hydro one is Using Hydrotherapy to Manage Developmental Conditions in the Dog with Tanya Grantham, and the equine one, Luxating Patella in Young Horses with Gillian Tabor. You can just head over to onlinepethealth.com/free to access those free webinars. A quick word from one of our sponsors before we dive into today's topic. At Paw Prosper, we believe true pet well-being demands a three-pronged approach: prevention, support, and rehabilitation. Our brands are trusted by veterinarians, universities, and rehab facilities alike. So whether you're looking to train, rehabilitate, or help your patients age gracefully, our brands, Walking Pets, Help 'em Up, Respond Animal Therapeutics, Fit Paws, Muffins, Halos, Sleepy Pod, and Canine Carts offer effective, innovative, and proven solutions. You can sign up today to receive a one-time special gift for all our Online Pet Health listeners with your next order, and you can sign up by going to pawprosper.com/OPH. All right, over to Anae and Megan.
Hi guys, and welcome. Hi Megan, thank you for joining me.
Hello.
So today we are doing a collaborative journal collab with SAAPRA, which is really great. It's been about a year since we've done these last, so I'm really looking forward to doing a few more. Today we're going to look at intervertebral disc herniation and a few articles that focus on that correlation between the degree of compression of the spinal cord and the severity of the clinical signs. There are a few interesting points in these articles that I think are going to be great for us in clinical practice. So Megan, thank you so much for joining me. Will you introduce yourself and then also start taking us through our first article?
Yes, so obviously my name is Megan. I work in George in the Western Cape. I am part of SAAPRA, one of two people in the education department, and I'm doing the journal clubs where we are going through some research on specific topics. And I am very excited. I enjoy these type of things.
Okay, thanks Megan. Our first article, can you take us through it?
Yes, so this first article was published in 2023, and the title of the article is "The Volume of Extruded Materials is Correlated with Neurological Severity in Small Breed Dogs with Type 1 Thoracolumbar Intervertebral Disc Herniation." So the objective of this study was to assess whether the volume of extruded materials is correlated with the neurological severity in dogs with our type 1 IVDD. The study group used 70 client-owned small breed dogs with diagnosed type 1 intervertebral disc disease. And then also, a nice thing that they did in the study was that for each dog, the volume of the disc immediately cranial to herniated disc they used as an internal control for that individual dog. As we know, type 1 intervertebral disc disease is observed most often in your chondrostrophic breeds, where the disc extrudes into the vertebral canal, and this injures the spinal cord. In these breeds, the chondroid metaplasia occurs in the nucleus pulposus early in life, and this degenerative process results in the calcification of this nucleus pulposus. So in the diagnosis of IVDD, they use myelography, where they use a contrast medium, CT scans, and MRI scans. So they have stated that MRI is the golden standard for the diagnosis of IVDD, but they have also said here that MRI also has low spatial resolution than CT, which may affect the anatomic details. So CT shows good morphological detail of the spinal cord, which is why in this study they used the CT to diagnose the disc lesion and the location of the disc. So they say that the severity of spinal cord injury can be influenced by a variety of factors, such as the rate of extrusion and the duration of the spinal cord compression. Many studies that have looked into this correlation, they look at the correlation between the maximal transverse spinal compression ratio. So this is just basically where they are comparing the area of the compressed spinal cord to a normal non-compressed area. And they have found that there is no correlation between this maximal transverse spinal cord compression ratio and the neurological severity. However, there has been one study that has found a moderate positive correlation between these two factors with your cervical spondylomyelopathy. And then this study hypothesized that the neurological severity of type 1 thoracolumbar intervertebral disc disease would be affected by the volume of the extruded materials. So with the animals, they had 70 dogs, and the dogs were excluded from the study if their records indicated that they had type 2 IVDD, if their spinal cord compression spanned more than 2 vertebrae, or if the severe spinal cord swelling interfered or produced an unclear contrast medium during the CT myelography. A neurological exam was also performed on all the dogs at the time of their admission to hospital. In the study, they used 5 grades of neurological severity, with grade 1 being spinal hyperesthesis only. Grade 2 was ambulatory paraparesis and ataxia. Grade 3 was your non-ambulatory paraparesis. Grade 4 was paraplegia with intact deep pain sensation. And grade 5 was paraplegia with no deep pain sensation. Then they used, as previously mentioned, the myelography CT to diagnose the disc lesion. And afterwards, a hemilaminectomy was performed, after which either the operating veterinarian would then follow up with the patients, or they would do it by telephone interviews. And then they graded a successful outcome after surgery, being that grade 1 was a disappearance of the hypersensitivity, grade 2 was an improvement of the ataxia, grades 3 and grade 4 was that the animal was ambulatory, and grade 5 was an improvement of deep pain sensation and the dog was ambulatory. Then they measured the intervertebral disc volume on the CT scan, and they measured it by means of a region of interest. They found, and then they also measured the volume of the discs immediately cranial to the herniated disc as an internal control to measure how much volume there was in the herniated disc compared to a normal disc. All right. Then in the results, so there was a total of 90 dogs, but there were 6 dogs that were excluded because their spinal cord compression extended beyond 2 vertebrae. 14 were excluded because the spinal cord swelling was severe. Spinal cord compression was severe. And then this resulted in only 70 dogs being eligible for this study. And the highest number of dogs in a specific breed was the miniature Dachshund. The mean age was 9.3 years and the mean weight was 6.4 kilograms. And then the median number of days from which the clinical signs were recognized until surgery was performed was 1 day, with the range being 0 to 7 days. So they performed the surgery quite soon after the diagnosis. So after surgery, in your grade 2 dogs, there was a 100% success rate in your grade 3, there was also a 100% success rate. In your grade 4 dogs, there was a 93%, and in your grade 5, there was only a 74% success rate. They also found that there was no correlation between the maximal transverse spinal cord compression ratio and the grade of neurological severity. The materials that were included in the disc material that they surgically removed was the nucleus pulposus, hemorrhage, and the torn annulus, and they stated that all of this can be involved in increasing the volume, which is compressing the spinal cord. And they found that there was a weak correlation between the volume of the extruded materials at the herniated site and the neurological severity of type 1 IVDD. They suggest that the volume of extruded materials is at least partially responsible for presenting neurological severity in dogs with type 1 IVDD. There was no correlation, however, between the maximal transverse spinal cord compression and neurological severity. And in previous studies, they have found that this maximal transverse ratio is not correlated with neurological severity in dogs with type 1 IVDD on the basis of MRI images. So this kind of indicates that if you had to do MRI or CT, it would give you the same result, that there was no correlation. So there's no difference in results between the diagnostic imaging types. The extent of compression may exert a greater effect on the spinal cord rather than the degree of local compression in the spinal cord, meaning that the longitudinal extent of injuries is greater than the degree of compression on the spine. Then they also state that it's not just the volume of the disc that is going to impact your damage or degree of damage to the spinal cord. It's also the force of the impact when the disc ruptures, the spinal cord displacement, and the acceleration in which this disc extrudes into the spinal cord. So it is known that acute disc herniation can lead to your spinal cord swelling. And a previous study found that in some dogs, the site of spinal cord compression is difficult to identify on your myelography because of the filling failure of the contrast medium due to the spinal cord swelling, which is what they did in the study. There were some limitations in the present study. They stated that it was a retrospective study design, and there was a moderate number of dogs. There was also a bias of breed, meaning that all the breeds were your small breed dogs, and there was a higher prevalence of Dachshunds compared to your other small breed or chondrostrophic breeds included in the study. They also stated that a lack or a limitation was the lack of MRI, which is stated to be the golden standard in diagnosing intervertebral disc disease. They used the discs immediately cranial to the herniated disc as a standard to compare the affected discs. There was a limitation that the current analysis did not allow for your confounding variables, and each disc was not individually normalized. So other covariates such as their dog breed and dog weight should also be considered. Then something interesting that they also state is that the chondrostrophy that leads to the chondroid metaplasia and the degeneration could be affecting all the discs in the spine to some degree. So when I read that, I understood it as because they are a chondrostrophic breed, it's not to say that the discs in the rest of the spine are also not affected to some degree. So now you're comparing a ruptured disc to another disc that might in fact not be considered normal in that there is chondrostrophy of that disc. Then they also say that what the most stable internal control is for assessment of intervertebral disc disease needs to be examined. And then also there needs to be a larger study to verify this correlation between the volume of extruded disc material and the grade of your neurological severity.
Super. Thank you so much. Thank you, Megan. That was really a quick run through. Very good. So what are the things that stood out for you in the study that really got you thinking?
I liked that they looked at just one type of disc material, and that it was only type 1 disc. I think it gets a little bit confusing if there's a whole lot of variables that we're all comparing. And then also the fact that there was I'll just try to go down to where they gave the amount of dogs. I can't remember where that is now. Oh, here we go. So there were 62 miniature Dachshunds, and then the rest range between 2 and 1 of each breed. So I think with that also kind of skews the data into one specific breed. Because now what if all of what we're finding is mostly correlated to Dachshunds, but what does that happen with the one mixed breed dog that was included in the study? Would these results also be the same if we had to have 62 mixed breed dogs as well?
Yeah, they could almost have limited their dogs included to just the 62 miniature Dachshunds, so that we could have had a clearer picture of that population instead of bringing in really small numbers of other breeds.
Yeah.
Or they could have also looked at those 62 as one group and then the other breeds as a separate group to compare whether the findings were the same between the two, the different breeds. So yeah, that's an interesting point.
Yeah, that's one. And then also the fact that there's no correlation between that transverse ratio and the severity of clinical signs, because to me it would be, well, if I had to think about it, I would suspect that the higher percentage of compression, the more severe your clinical signs will be as well, which they say is not really, there's no correlation between the two factors.
So what you're saying is that, or what they've said is that upward compression, or the compression across the cross-sectional area, isn't the part that's making the difference. It's how much longitudinal pressure is being put on. Is that what you're saying?
Yeah, that to me is what I kind of get from this. And also that it's not just the volume, it's also how long the spine has been compressed for. The type of disc rupture, such as this disc extrusion, the velocity that the disc ruptured, and I would assume also bleeding and swelling, all of that is all going to add to the volume of the disc compression.
Yeah, there's always multiple factors that we need to think of. It's really difficult to control for all of that, right?
Yeah.
And to also predict that. So for us in clinical practice, like a Dashi comes in, they're post hemilaminectomy. How does that affect, how do those factors all affect our treatment at the end of the day? And the information that we're giving to the owners, right? The prognosis for the patient, the long-term prognosis for the patient. That's really what we want to know, is what is the prognosis and how do we support the owner through that, and the pet, of course, the dog, of course, with the best possible treatment plan. So that's awesome. I love it. Thank you. Should we move on to the second paper?
Yeah, I'm happy to. Okay, so this study was published in 2024, and they looked at the relationship between the severity of neurological signs in dogs with thoracolumbar intervertebral disc disease and the magnitude of spinal cord compression by disc extrusion as assessed by your computed tomography. So similarities between this article and the previous one is that we are looking in the same area of the spine, so the thoracolumbar spine. And we are also using computed tomography, or CT, to diagnose the disc lesion or the IVDD. Because I think if you also had to compare different diagnostic imaging, I think it would also get a little bit confusing to see what are we finding, especially because the last article, it was a year earlier. So it's nice to also see how they've progressed in this research topic. So, and if I remember, so this one did not use the myelography, they just used the CT. So they didn't use a contrast medium like the other study did. So the aim of this study was to verify the relationship between the degree of severity of neurological signs in dogs with IVDD and the magnitude of spinal cord compression through the diagnosis of a CT scan with a transverse view of the vertebra at the site of greatest narrowing of the spinal canal. In this study, they used 78 dogs. Right, so here they just speak a little bit about CT as being one of the complementary options for relatively rapid preoperative prognostic assessment in dogs affected with thoracolumbar IVDD. So they basically stated that it is a more readily available diagnostic imaging modality in our vet clinics compared to an MRI, and also that it's quite rapid. So if a dog comes in who needs IVDD surgery, it's quite quick and easy to do the CT scan to then determine the prognosis for that specific dog. But they also stated that each diagnostic modality has its own limitations, and therefore it may not be reliable in determining the possible relationship between the two. As previously mentioned in the other study, they say that several studies found that there was no correlation between this maximum transverse spinal cord compression ratio and the severity of the neurological status. And they did find a moderate positive correlation between these two factors when looking at cervical spondylomyelopathy. Okay, so they also say that to date, however, no public scientific data has examined the relationship between the degree of severity of your neurological impairment and the percentage of narrowing of the spinal cord at the site of extrusion of the disc materials on CT scans, which was the objective of this study. So it is the first study to look at those two factors and determine the relationship between the two. So with materials and methods, so this study had both chondrostrophic and non-chondrostrophic breeds, and then they were then grouped accordingly to being chondrostrophic and non-chondrostrophic. So again, we can see that the Dachshund is the most prevalent again, followed by the French Bulldog, but there's quite a big jump between 44 Dachshunds and 4 French Bulldogs, and then it goes down in descending order. So I guess that brings up the same thing again about whether the Dachshunds are skewing the results a little bit. And then obviously there's big differences in ages and weight because it's differences between small dogs and your large breed dogs. So the ages were 2 to 15 years and the weight was 2.10 kilograms to 53 kilograms. And then, here they kind of have a different neurological impairment grading system compared to the other or the previous study. This one had 6 groups instead of 5, and here they had grade 1, which was just a first episode of back pain and there was no motor deficit. Grade 2 was recurrent pain and or mild to moderate paraparesis. Grade 3 was severe paraparesis. Grade 4A, so they divided grade 4 into a further 4 subcategories. So A was paraplegia with preserved deep pain. B was paraplegia with deep pain absent for less than 48 hours. And C was paraplegia with deep pain that was absent for more than 48 hours. Okay, then with the results, so I just wanted to give the numbers here as well, in that there was 55 chondrostrophic dog breeds and 23 non-chondrostrophic dogs. And then also quite interestingly is that they said in the 55 dogs of chondrostrophic breeds, there was a total of 65 intervertebral discs affected by the extrusion. So in this study, it seems that they did not exclude dogs that had more than 1 disc extrusion, where the other study only looked at they only had 1 disc. And so that is a little bit different as well compared to the other one. And then here's just a whole bunch of numerical values where they're looking at the inches of the volume of the disc material in the spinal cord. All right, so it was shown that there was a high statistical significance that chondrostrophic breeds generally show a higher degree of neurological impairment compared to your non-chondrostrophic breeds. But I think we all know that your chondrostrophic breeds are going to show a higher degree. And I think it also comes to, because now we're also comparing type 1 IVDD and type 2 IVDD, and that method of disc protrusion and extrusion are different, but they do mention that later on, which we'll go through as well. Then here's just a graph where they looked at the breeds and the degree of severity of neurological signs. Yes.
So they did separate out that data and say if we look at the chondrodystrophic versus the non-chondrodystrophic, what is the difference? I like that. So what is the difference here?
So we're seeing that your chondrostrophic have a higher degree of severity of signs, of neurological signs. So awesome. There's a grade 3 and then the grade 4B. Okay, so then in terms of other variables observed, when they're comparing the group of condystrophic dog breeds with the group of non-condystrophic dog breeds, no significant difference was found in the percentage of spinal canal narrowing at the site of greatest spinal cord compression by the disc material. So yeah, there was no difference when the spinal cord narrowing, that there was no big difference between your condystrophic and your non-condystrophic breeds. And then when they compared the severity of the degree of neurological signs, as classified by the 6 grades that they used in the study, among the dogs of the Dachshund breed, dogs of other condystrophic breeds in the study population, and dogs of non-condystrophic breeds, a significantly higher degree of severity of neurological impairment was observed in your Dachshunds compared to your non-condystrophic breeds. But when I read this, I also again think about, but they have the Dachshunds have a higher population number compared to the other dogs. So maybe that's why we're seeing this higher degree of severity of neurological impairment, because there's not an even number to compare fairly, I would guess. All right. And then they're basically just saying what we saw in the graph, where they're looking at the grades and all of that. Then there was no difference found in the severity of neurological signs between Dachshund dogs and dogs of other condystrophic breeds in the patient group, or between dogs of condystrophic breeds and dogs of non-condystrophic breeds. So they're not finding any difference in the severity of signs if they compare just the Dachshunds to other dogs in the same group, or between dogs of other condystrophic breeds and dogs of condystrophic breeds. So even though there's a difference in the severity of neurological impairment, there's not really a big difference in the severity of the signs that we are seeing.
I love that they've taken the patients that have been included and separated them and done the statistical analysis on the different groups and then compared that. I think that's very useful.
Yeah, I think they saw the higher prevalence of the Dachshund, and then, because I mean that's what we were interested in the previous study, was what would happen if you had to compare them with the others. And yeah, that's exactly what they did here. So I think they took from the previous study and built up on the limitations of that.
Yeah.
Okay. Then when they were comparing the percentage of spinal canal narrowing at the site of greatest spinal cord compression by the extruded disc material between males and females in the study group of both the condystrophic and non-condystrophic dogs, the females showed a significantly higher percentage of spinal cord compression by the extruded disc material. But there was no difference between males and females in the severity of a neurological impairment. So again, they find that in females, there's a higher percentage of spinal cord compression, but if they go and look at just the neurological signs, there's no big difference or no significant difference between the males and the females when they compare the different factors. And then they also looked at the neutered individuals. And also here they found that the highest percentage of spinal canal narrowing at the site of greatest spinal cord compression was found in your neutered females compared to your unneutered females, and when comparing your neutered males to your unneutered males. So again, in our neutered dogs, there's also a higher prevalence of this spinal cord compression.
Yeah, that's really interesting.
Yeah, it makes you kind of think about whether if you spay them, especially dogs that are diagnosed early on, especially like the Dachshunds and Frenchies, where they can be diagnosed quite early in life, whether neutering them, would that impact a disc extrusion or disc protrusion later in life?
Yeah. We did a research refresh on and specifically looking at the health issues around staying intact or neutering, the health and the behavioral issues actually. So if you guys are interested in diving more into that, definitely watch that research refresh. But early sterilization can definitely increase the risk of many conditions. So I think that's somewhere where we should shift our normal practices away from early sterilization and towards either later sterilization or, where it is possible, alternative options. Yeah, it's a tricky one.
Yeah, it is. And then also another interesting thing that they found was that the smallest percentage of narrowing of the spinal cord was at the L2 to L3 disc space. And then the highest percentage was at T11 to T12. Okay, and then here's another graph. So this is where they're now they're separating the Dachshunds from the other, the two groups as well. And we can see again that they're higher. And I think also we can also see if you add the Dachshund with the chondrodystrophic breed as the previous graph showed, I think you can kind of see how it skews the results a little bit, because if I don't remember correctly, the graph was a bit higher up if they were together. So
yeah, I think it just really highlights that increased risk in the Dachshund breed.
Yeah. And then this one is the same.
Okay, so the degree of severity of the neurological signs.
Oh, and then the neurological signs.
The same pattern repeated. So it just shows that correlation between the severity of the injury and then the severity of the neurological signs, which, yeah.
Yeah, interesting. Okay, then there's another graph. Oh, this is where they look at neutered, unneutered, neutered, unneutered.
So do they go male and then female?
Yeah, I'm going to zoom out just one so we can just put the graph on one picture. There. Okay, so yeah, neutered females are the highest.
Sure, that is significantly higher.
Yeah.
Okay, so then from this, I would kind of say, well, if I had a female Dachshund, miniature Dachshund, I would probably not want to sterilize her if I had that option. And if I did have to sterilize her, I would do it as late as possible in life. So after that first year mark and potentially even towards the 2-year mark. That would kind of be my guess there, or my recommendation, or the decision I would make for myself if I got a miniature Dachshund female.
Yeah, no, definitely.
Okay.
All right. And then here's another one.
Okay, looking at the level or the intervertebral disc spaces. So my question here would kind of be, if we're thinking of which level the compression is at, we've kind of established that the degree of compression is connected to the severity of the neurological impairment. So then if there is a greater degree of compression from T11 to T13, does that mean that there's more severe clinical signs or more severe neurological impairment when the compression is at that level versus in the lumbar region? Or can we not really make that connection?
Yeah, no, I think it's, but yeah, I think we've always known that the location of the disc plays a big role, and I think this just kind of solidifies that thought process a bit, or it puts the thought into paper and research, and
yeah.
All right. Okay, in the discussion, so they're kind of just reiterating here why they used CT scanning. Yeah, because they say here that they chose it as a relatively fast and simple method because it's also more readily available compared to an MRI. And then to date, it has been shown that the severity of clinical signs and thus the impairment of spinal cord function and structure due to the intervertebral disc herniation is influenced by the factors such as the rate of the compression force, the degree of the compression, the duration of the compression, and the duration of spinal cord diameter to spinal canal diameter. And then they also say that the high kinetic energy of the disc acting on the spinal cord, the volume of the disc material, and the total length of the compressing material within the spinal cord space or multiple disc extrusions often cause varying degrees of spinal cord edema. And all these factors subsequently affect the prognosis of the case. So I think it's mostly not just measuring how much volume is in the disc, it's also all of these other factors as well. And then they also state the type of or the structure of the disc material. So is it granular or a pasty disc material? Is it the annulus fibrosus together with a degenerated disc nucleus? Is it there also bleeding or hemorrhage in the spinal cord as well? So I think there's a lot of factors more than just how badly is the spinal cord being compressed. And then they also say that all of these things can increase the volume of the compressing material. And then obviously also the duration of this compression is also an important factor. Okay, then they found a weak positive correlation most recently in the study. This is a study that we did previously. They found a weak positive correlation between the volume of extruded disc material and the neurological severity in your specifically type 1 IVDD. And then the authors suggested that the volume of material is at least partially responsible for the observed severity of neurological signs in dogs with type 1, specifically IVDD. And then they say that there's no correlation between the maximum transverse spinal cord compression ratio and the neurological severity has yet been demonstrated.
So looking at that cross-sectional compression versus the longitudinal compression, that's really interesting, because I would have thought that the transverse spinal cord compression is relevant, right? Like if we think back to that little rhyme or diagram that we have where you lose neurological function in a specific order and then you regain it in a specific order, at least for me, I learned that that is related to the spinal tracts and the order in which they're being compressed, which is the transverse compression. So I think that's really interesting.
Yeah, it kind of rethinks especially how a dog is progressing. Yeah, because based on that order, I would always look at, okay, they've regained deep pain, they've regained superficial pain, okay, they've regained bladder. That means that the pressure on the spine is being alleviated. But yeah, there's a few times where I would have patients who are walking, they have the deep pain, all of that, but they're still struggling with bladder control and all of that. So it does kind of question that chronological order, basically, of events in the spinal cord. I think it does still play a part. I mean, there's a few times where that does, it does go in that way. And I think it does also to wrap our brains around it, because the neurological system is so, complex. There's so much about it. Every time I read it, I feel like my brain is going to, and I think it just kind of helps to simplify it maybe a little bit, to give a bit more of a guideline. But I think this article is also showing that that's also not the golden standard, that it might be a guideline, but it's not necessarily the rule with it.
I think you just summed that up really, really nicely. Because I've always really questioned that. Is it feels too simple to say that we lose function in the specific order and then we regain it in that specific order again. It's too simplified, and it doesn't account for all the variables that are involved in neurological dysfunction. So I think you just summarized it really well. It's a nice starting point. It simplifies it for us. It's a really nice way for us to describe or educate our owners, to give them some expectations around how things are going to progress or what they can expect. But it isn't the rule. It is just a structure for us to use and to use to educate our owners and to simplify the process a little bit for ourselves as well. So, well said.
Thanks. Yeah. Okay. Then the pressure of the material in contact with the spinal cord is known to influence the severity of the spinal cord injury and depends on the extent of the extradural lesion. And then they obviously state, as do a number of other factors, as we've gone through before. And then here they're just giving a bit of a descending order based on the highest percentage of the spinal cord narrowing based on the extruded disc material. So as we know that the highest is T11 to T12, and then it goes down to T13 to L1, T12 to T13, T10 to 11, L1 to 2, and then the lowest is L2 to 3. Okay, then the more severe degree of neurological impairment in your chondrostrophic dog breeds can be related to the fact that the structure of the disc material also plays a role in the severity of the spinal cord. So your chondrostrophic breeds will usually have a harder granular disc material, and also that in your chondrostrophic breeds, the extrusion of the degenerative disc nucleus and part of the dorsal annulus fibrosus is usually involved. So at the same time, during this herniation, bleeding from the extrusions of the damaged vertebral sinuses may occur. So all of these factors can increase the volume of the spinal cord compressing material. So then they compare it to your non-chondrostrophic breed. So they say if you look at all of these factors, they can or they may play a role because in your less traumatic protrusion of the fibrinoid degenerative disc in your non-chondrostrophic dog breeds compared to the spinal tissue. So I think what's also nice that they added your chondrostrophic and non-chondrostrophic is that we're kind of seeing the way that the disc ruptures, be it extrusion or protrusion. I think that's just also, they're just kind of showing that your velocity of disc extrusion and the speed and all of that does actually play a role in how it's going to affect the damage to the spinal cord. And then in addition to that, when they're comparing the Dachshund dogs of other chondrostrophic breeds and dogs of your non-chondrostrophic breeds in the patient cohort under study, they demonstrated that Dachshunds presented with a significantly higher degree of severity of neurological impairment, compared to dogs of your non-chondrostrophic breeds. And then this is kind of what I said already, where they're just stating that this is related to the fact that the degenerated granular disc material is harder in your Dachshunds, and the acute and explosive extrusion of the degenerated nucleus with the dorsal part of the intervertebral disc annulus is a more traumatic process for the spinal cord from a biomechanical point of view, compared to the herniation in your non-chondrostrophic breeds, where it is a partial dislocation of the nucleus and only a partial herniation of the disc in the spinal canal, which is less traumatic from a mechanical point of view in the spinal cord. And then the study also found new findings in the relationship of the sex to some of the observed variables, where they found that your neutered females have a higher degree of your compression of disc material compared to your intact males and females. And they say here that this is due to the effect of estrogen acting against disc degeneration. But this is unknown, and obviously further studies will need to clarify these similar questions to see is the estrogen actually playing a role. All right, then this is just the reiteration of T11 to 12. And then in conclusion, they're just saying again that the CT is useful and that it does what it needs to do. It is fast, it is reliable, and further studies will have to follow up to clarify other possible clinical associations with some of the findings of this study in dogs with thoracolumbar intervertebral disc disease based on their CT evaluations.
That is fantastic. Thank you so much, Megan.
Yeah.
Okay, so what is the bottom line conclusion point of all of this is that the more the spinal cord is compressed by disc extrusion, the worse the neurological signs will be, right?
Yes.
Okay, perfect. All of the dogs in both these studies had surgery, right? I didn't miss that. None of them were treated conservatively.
Yeah, I think they all had surgery, yeah. They didn't compare different surgery types.
Okay. So when we were planning this, you kind of had that question in your mind of that order where neurological function is lost and then regained. Have these studies answered those questions for you? Has it clarified it, or do you still have questions around that? Has your thinking shifted? What do you think?
It's kind of left me with a little bit more questions than answers, because then I started to think along the routes of the conservative treatment and the surgical treatment based on what we know with the anatomy specifically. And then it has kind of, I think we've always known this, but I think it's just kind of reiterated to me that it's also based on the individual dog, that just because we have a certain way that we would expect neuroscience to present or to improve, it's not necessary to say that it's going to be like that all the time.
Okay. I want to look at this grading system that they used in this paper a little bit more, because I love objective outcome measures, and grading systems are one of the simplest ways that we can bring some objectivity into our evaluations and into our practices, really. So the primary difference between the grading systems is that they had levels to number 4 in this one, right? They had 4A, B, C, D. Just go through that again. What were those? How did they change that grade? And what impact does that have at the end of the day? How does that help us? Or does it just add a level of complexity that we really don't need in clinical practice?
Yes, I'm just trying to see here. Oh, here we go. Okay, so they said grade 1 was just a first episode of back pain and no motor deficit. Grade 2 was recurrent pain and or mild to moderate paraparesis. Grade 3 was severe paraparesis. Then grade 4 is the one that they divided into 3 subcategories. So A was paraplegia with preserved deep pain. B was paraplegia with deep pain absent for less than 48 hours. And C was paraplegia with deep pain absent for more than 48 hours.
So it's really interesting that they have that grade 4, including and excluding deep pain. So 4A, deep pain is still intact, and 4B, deep pain is absent. And then they put a timer on that, and your grade goes up with the length of time that deep pain has been absent. Yes. That's an interesting way to grade that, because then you could, I mean, we don't always have that information. How long has deep pain been absent? So you could just divide that into 4A and 4B if you don't have that information. Either deep pain is present, or deep pain is present, so 4A, or deep pain is absent, and then it goes to 4B if we don't have that information on how long it's been absent.
Yes, yeah.
Interesting.
Yeah.
And this would be prior to surgery. They've graded it this prior to surgery.
Yes. Yeah, when they did the medical history, a clinical exam, a neurological exam, and then the CT to diagnose. Yeah, that's pretty cool.
Okay, yeah. I mean, there are so many questions, because now the question is, okay, well, then how did they recover post-op? But that isn't what the study looked at. So we can't ask that question.
And also the fact that I think the study also showed that there's so many different neurological grading systems, because the previous study also had 5 groups, sorry. And I mean, it just, like, which one do you use? Which one is the most accurate? Which one, like, if I could speak to a different vet, like, which grading system is he or she using compared to the one that I'm using? Or
it is such a good point, and it's why I love talking about objective outcome measures so much, because if there is no standardization in the grading systems that we use, for example, and that could be for everything, for palpation through to functional grading systems. If we don't have some sort of standardization, then we can't really talk to each other and compare outcomes or compare data on specific patient groups, because we're looking at different things. So I love things like the FinFun, which is the Finnish neurological scale. We've spoken about that as well, because it gives us, especially from our perspective as rehab therapists or physiotherapists, what are the functional outcomes that we're looking for in our neurological patients. And then it gives us a much more comprehensive scale to work with. And that's something we can all incorporate and then become more objective with, which will make retrospective studies much more valuable to us in the long run, because these are both retrospective studies and they have limitations in terms of selection bias and your data handling bias, the collection of the information from owners, right? Some of it was done telephonically, and that creates some bias and some limitations in your studies. But if we were using the same outcome measures, we would be able to compare our data with one another, and then we would have much larger patient groups and much more to talk about. My bad.
Yeah, and also to me, it also feels like, can you actually divide these into 6 groups? Because what if there's a patient that maybe like also if you had to look at severe paraparesis, my version of severe and someone else's version of severe is also different. So even though we might all have the same like grading system, I think also the words used, because of the mild, moderate to severe, I think that can also differ slightly per person.
Yeah, definitely. Definitely. It's too vague. It needs to be far more specific. Yeah.
Yeah. And then I think also when it becomes a bit more specific, that's also when it becomes a bit more tedious, because then you have so many groups that you have to try and read through and differentiate which one the dog falls under. And it's very confusing.
I hear you. Okay, so from reading these two papers, what are you going to be taking back to your clinical practice with you?
Well, the first one is definitely about neutered and unneutered. That's definitely something I'm going to be looking at. And then also basically just like what I would expect the outcome in my specific patient to be, because a lot of the time with neuro dogs or neurological dogs, the owner, one of the first questions they ask is, how long do you think it's going to take until they walk again? And we don't know. We can try as much as we can. We can be optimistic until proven otherwise. But I think it kind of also just shows that just because what we've seen in the diagnostic imaging might not be how they're going to present. So that's just kind of, I think it's just going to help to answer that question a little bit for owners when they ask how long do you think it's going to take. And
really getting into that prognostic information, right? So that's the future research refresh or journal club, where we look at some data on the long-term prognosis, which they didn't talk about in these ones.
Yeah, exactly.
Awesome, Megan, thank you so much for joining me today and for sharing these articles with us. This has been really interesting. For those that are watching, if you have any questions or thoughts or differing experiences that you want to share, we would love to hear from you. If you have suggestions for future research articles that we should cover, again, let us know, because we love to give you guys what you are looking for. Awesome. Have a great day, guys.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Paul Prosper. Their sponsorship allows us to be able to give this podcast to you for free, so please go and check them out, paulprosper.com. Don't forget to bookmark the next Vet Rehab Summit. It's on Saturday, the 31st of October, 2026. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Onlinepethealth members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com. And if you want access to our free membership, we update the webinars in this area every 3 months. You can sign up at onlinepethealth.com/free.